We're doing top 5 questions regarding hair transplant surgeries. These are the questions that most patients ask us and they want to know. So first one is, does it hurt? Hair transplant surgery should not really hurt. It should be a very minimally painful procedure. There should be very little discomfort, and the recovery and the post-op period should be the same. If the procedure is hurting or the recovery is painful, then something generally was not done right. Either the anesthesia wasn't properly performed or the procedure was not properly performed. So the only pain that our patients really experience or discomfort is about 60 seconds of burning in the back of the scalp. That's when I'm doing the injections to numb them up. And later in the day, if we're doing the hairline, it's about another 60 seconds of a couple of small injections. It's very similar to if you cut your hand and needed to get stitches. It's really not a big deal as long as the anesthesia is done properly. If it's not done properly, then that's a whole different story. But a hair transplant should really be a minimally painless procedure. The second question is, how long does a hair transplant surgery take, and whether a strip or an FUE takes longer or shorter. The reality is a hair transplant done by us takes about 6 to 8 hours. It doesn't matter whether we're doing strip or FUE, both of them are the same. It's the same day. The only difference between the two procedures is how we are removing hair from the back of the scalp. Generally, our strip surgeries are a little bit bigger, so we get more grafts, and therefore I spend more time creating the recipient site incisions, and the placement is a little bit longer. In an FUE, we're harvesting a little less grafts. The harvesting takes longer, but now you have less incisions to make and less placement. So all in all, it's about 6 to 8 hours. We only do one surgery per day. That way we're focused on your surgery and your case. There's a lot of practices that do 5 to 10 hair surgeries in a day. Good for them. That's not us. We really just do high quality, high-end work, and the majority of the cases are done by me, and they take me a long time to do, and that's just what it is. So our cases take about 6 to 8 hours. Other places I've heard do it in 2, and I've heard other places spend 10 to 12 hours. Both of those are kind of ridiculous in my perspective. I think a hair transplant properly done with a proper team, with a staff and clinic that knows what they're doing, probably about 6 to 8 hours. The other question patients always ask is, do hair transplants look natural? Today, if a hair transplant surgery is performed properly, it should look very natural. Nobody should really look at you and know that you had a hair surgery done. That is a good cosmetic procedure. And if you look at our results and you look at the stuff we post, it looks really, really great. And it looks really great because we know what we're doing. We've been doing this for a long time. I've been doing this almost 14 years every day. And obviously people are not coming into my office leaving with unnatural results. That's not the goal of a hair transplant. They should look amazing and they should look really good. And if they don't, again, that really has to do with how the transplant was done. There's a lot of places people can cut corners, and that can make a hair transplant not look so great. And if the time is taken and a surgeon knows what they're doing, a transplant should look absolutely fantastic. The other question that patients ask us is, what is the recovery? And my question to them is, what do you mean by recovery? What do you want to do after the hair surgery? Do you want to go headbutt a soccer ball because you're a professional football player? Or do you want to just sit on your computer and work? The reality is the recovery is very, very easy. There's not a lot of pain with strip or the FUE. We don't do any kind of pain medications afterwards other than just Tylenol or Advil. And in terms of what you can and can't do, we recommend no exercising for 2 weeks. Wow, we got like a emergency going on outside. We recommend no exercising for about 2 weeks after the surgery. You wash your hair twice a day for 2 weeks following the surgery, and you can go back to like your normal life the next day. Obviously there are going to be some signs that you've had a hair surgery. If you want to hide that, we have patients wear a loose fitting hat about 4 days after the procedure, and that way their recovery goes really well. One of the other questions we get asked is pre-op. What do I need to do to prepare for my hair transplant surgery? It's pretty easy. The first is stop reading the internet and stop freaking yourself out, because I get a lot of patients who they sign up for surgery and then they go home and they start scouring the internet and they come back just freaked out with a million questions. That's great, but let's answer those questions and not go back to the internet and start looking at a million other things, because you can just find so much stuff out there that is not going to happen when a qualified surgeon and a qualified practice is doing your hair transplant. The other big question patients ask me is, do I need to take any medications beforehand? Do I need to take antibiotics? Do I need to do anything like that? We don't do antibiotics before surgery. A lot of practices do. In the 14 years I've been doing this, I haven't had a post-op infection yet. And if we do, we can treat it with antibiotics, but I don't see the need to place every single patient blanketly on antibiotics prior to a surgery. If you have, like implanted devices, knee replacements, heart valves, stuff like that, then we may need to do preoperative antibiotics, but generally we don't do any kind of medications or anything like that beforehand. If patients are on medical management, we have them continue the medical management up to the surgery, but outside of that, just kind of come in, let us do our thing, and that's that. The other big thing is just don't take any blood thinners, any aspirin, any kind of NSAIDs like ibuprofen, Motrin, Advil, Aleve, anything that's going to make you bleed longer, because that just makes my day tougher and I don't like to have a tough day. So let's avoid those kinds of medications beforehand, and we give all our patients instructions. We do a pre-op appointment and we go over everything with them. So I think those are the top 5 questions in regards to a hair transplant surgery. If you have any other questions, always feel free to reach out to us. You can email us. I personally respond to everybody's email, and we will get back to you and try to help you answer any other questions that you have. Thanks for watching.